Hello, this is Deborah Sadek, and I will be presenting my research on using photography to help improve documentation for elderly hospice patients. Patients receiving hospice care oftentimes have compromised skin integrity due to poor nutrition, impaired mobility, and advanced disease. This can lead to painful skin breakdown. Preparing the registered nurse case manager, or RNCM, with the proper tools to assess and access and document skin breakdown can improve the patient outcomes, including increased comfort and decreased pain and infection. Establishing a baseline of care with the patient and family at the establishment of the hospice service enables the record to be properly recorded. In order to properly prepare those in the RNCM position to provide individualized care to the hospice patient who are at risk for compromised skin integrity, a tool should be provided that is easy to use, timely, and based on current evidence. Ongoing and regular assessments of pressure ulcer risk is also an important responsibility of the RN case manager, as those patients receiving palliative care will be facing the progressive deterioration of the skin, which is the largest organ. Assessing the skin of these patients can be difficult, as RN case managers have varying degrees of expertise in wound care, and training may be sporadic. Caring for patients in the home setting where there is inconsistency in lighting and optimization of visualization of wounds may be difficult, especially if the patients are in their own beds. Hospice nursing requires that the RN case manager act autonomously, as many patients are located within the homes, and nurses must rely on their own clinical judgment in many instances to provide care. With the number of elderly expected to reach 1.4 billion worldwide by 2030, more resources will be necessary to provide care, including hospice care. Today, 1 in 8 people worldwide is over the age of 60, and by 2030, 1 in 6 people will be. A significant increase among those over 80, who currently number 202 million worldwide, is expected, and that group is to account for 424 million people by 2050. Nurses preparing to care for this aging population must contend with how to best allocate resources, train caregivers, and embrace new care modalities in meeting patient needs. Medicare identified approximately 8.2 million patients in the United States with wounds requiring treatment, including treatment of chronic wounds, which costs between $28 and $96 billion yearly to treat. Up to $207 million is spent on the wound care of hospice patients. As many as 70% of all hospice patients will experience skin integrity issues while receiving hospice care. The purpose of this quality improvement project is to see if providing education and training, as well as a mobile application which RN case managers can use in the field, will lead to improved documentation for the hospice patients. This progress will be examined through the use of the electronic health record, or EHR, to measure current rates of documented impaired skin integrity and compare those rates to the incident rates after education and the skin assessment tools are implemented. Patients impacted by this quality improvement project will be elderly patients receiving hospice care at home who live in various rural counties in the southeastern United States. Patients receiving care will include, but not be limited to, having a diagnosis of end-stage renal disease, Alzheimer's disease, and other neurological disorders, heart disease, including CHF, and cancer. Hospice patients have an estimated life expectancy of 6 months or less if their disease follows the expected path. A search for relevant literature was performed using library resources at Maryville University of St. Louis. The search parameters included peer-reviewed articles published between 2014 and 2021, where full text was available. An initial search of the cumulative index to nursing and allied health literature database with keywords wound, mHealth, or mobile health, led to 5 results. PubMed was searched using the keywords wound, home health, and mHealth with 9 results. Another search of PubMed with keywords hospice and mHealth garnered 10 results. An additional search of Medline produced 9 results for the keywords documentation and mHealth. And wound care brought about 84 results. Articles containing those search words totaled 127. After a title review, 57 articles remained. Upon further exploration of an abstract review, 34 articles were read for inclusion in the review, and 20 articles were included in the literature review. Strengths of the literature review include themes of documentation, mHealth, and wound care. This provided an outstanding array of studies which lent to the understanding of how documenting wounds in mHealth can lead to improved patient outcomes. Using a cluster randomized control trial enabled researchers in Ghana to cluster participants by location rather than recruiting individuals to the study. This enabled more than 31,000 patients to be followed, which would not have been possible if individual recruitment was used. While designing an application to track the medication needs of hospice patients in both rural and urban areas, researchers were able to recruit 455 users of a mobile app, which enabled researchers to explore many data points, according to Namasango. Cohen et al. enlisted 415 RNs out of over 1,700 who were invited to participate in a survey which measured the types of education that were successful in teaching wound care to providers. Of these respondents, the average length of time as a wound care specialist was 14 years, which lent to the experience of those who participated in this research. Many studies were conducted with small sample sizes, including a study of wound image quality by Zhang in 2021, where only 21 respondents were enrolled in the study and only 15 participated in the actual photography of wounds. In the development of the bedside mobility app, the sample size of RNs using this app during the study was 33. Another study where a mobile app was designed to document on chronic wounds had only 8 RNs participate, according to Friesen in 2013. According to Faber and Fonseca, having such a small sample size can prevent valuable information from being extrapolated. The theoretical framework that provided the structure for this quality improvement project is Lewin's change theory. The 3 tenets of this theory, unfreeze, change, and freeze, have proven to provide a framework for nursing change for nearly 70 years. When implementing a change and targeting for change, which is considered unfreezing, a systemic rollout of the new project should take place, which would be the change, and those practices should be followed until they become standard practice, which would be considered the freezing. The project began by unfreezing the current situation regarding the documentation of wounds. In order to apply Lewin's theory, patient records were analyzed for indications of the presence of wounds, which covered decubitus ulcers, including bed sores, pressure ulcers, pressure areas, and pressure sores. The change took place through an education program for RN case managers where they had the mobile app downloaded onto their work iPads after participating in a teaching session where they were taught how to conduct a proper skin assessment, including taking pictures of any areas of concern and uploading those pictures into the patient's electronic health record. Moving on to freeze, an analysis of records again took place 4 weeks after this change, ensuring that the freeze takes place. During that time, reports showing the percentage of RN case managers using the app and the number of skin assessments performed was analyzed. The goal was that proper documentation of wounds led to proper treatment, improving patient outcomes such as a reduction of infection and pain, as well as increasing the confidence of the RN case managers to provide skin care to this vulnerable population. Using a mobile application enables the nurse to upload photographs to the patient's electronic health record. Once uploaded, the attending physician, clinical managers, and others in the interdisciplinary team, or IDT, can collaborate regarding the best course of treatment. The rationale for this study is supported by research, which shows benefits from increased technology in healthcare to improve patient outcomes. It is said that a picture is worth 1,000 words, as pictures give clearer understanding of a situation. Documentation leads to enhanced communication, which is supported by multiple studies. Step 1, the data collection began after the IRB approval. The data collection began on April 17th, 2022. The records were reviewed for the inclusion criteria, which included that the hospice patients had to be on hospice services for at least 2 weeks before the initiation of the project. During the time of the project, there could be no hospitalizations, and the patients must be between ages 65 and 89 years old. After that, a numerical identifier was assigned so that no patient data was accidentally released, and the initial patient records were then identified. On May 10th, 2022 and May 12th, 2022, the RN case managers attended a training session to review the proper skin assessment procedure and steps for documenting the Consolo WellSky EHR. Step 6, the RN case managers each had the mobile measurement app downloaded onto their mobile device. The mobile devices are paid for by the company. RN case managers were trained to properly photograph skin wounds using the mobile app and upload the pictures to the patient's electronic health record. The data collection process commenced on June 4th, 2022, when the researcher had 42 separate patients who met the inclusion criteria, had no hospitalizations during the study, and whom had 7 weeks worth of assessment data. When measuring to see if using a smartphone application improved the quality of documentation for elderly hospice patients with skin breakdown, an analysis of the patient record was conducted. Registered nurse case managers are expected to complete a weekly targeted skin assessment on their patient. RN case managers oftentimes conduct weekly assessments without completing the targeted skin assessment, despite that expectation. Initially, patient records were accessed using the electronic health record for each hospice patient who's at least 65 years of age and had been on hospice services for at least 2 weeks. Records were analyzed for the 3 weeks prior to the implementation of the education and intervention and introduction of the mobile application. The number of assessments completed for the previous 3 weeks was tallied, and this number was the beginning number of assessments. The Medicare hospice benefit is available to all Medicare recipients facing terminal diagnosis, which means that their life expectancy is less than 6 months. For this project, all patients resided either in private homes or in assisted living or long-term care centers. No patients received care in a hospital or designated hospice house. A preliminary meeting was held in February 2022 with Maryville University statistician Dr. Mark Pauls. It was determined that 42 separate patients were to be followed for 6 weeks. In all, 230 patient records were accessed for this study. The inclusion criteria for this project included that patients must be receiving hospice services. As of April 4th, 2022, which was 2 weeks before the beginning of data collection. All patients must be between 65 and 89, be part of the project. Each participant needed to have a hospice diagnosis, and the patient could not receive any care at the hospital. The data was collected by the study author. No transcriptionist was hired. All data was collected and analyzed using HIPAA compliance to ensure that no patient data is compromised. The data was then shared with the statistician from Maryville University, where a z-test was conducted using SPSS. The z-test for the difference of two proportions is a paired test, utilizing the pre and post measures. It required 42 patients' records over 6 weeks to collect enough data to show statistical significance. Since it was a goal of this researcher to show statistical significance, the records of the same 42 patients were analyzed. Since the patients were receiving hospice service, there was a higher likelihood that all patients would not survive during the entire study. Therefore, an adequate number of patients' records needed to be enrolled in the study to ensure ending data of at least 42 patients. Here's an example of the data collection form, which was designed by the researcher for this study. Answers were given in numeric identifiers, with 1 representing yes and 2 representing no. Answers were all nominal data. Several strategies were in place to assure the quality and adequacy of the data. Registered nurse case managers were present for an educational intervention, which included the proper methods for conducting a skin assessment, as well as access to the mobile application to record skin breakdown. Each RN case manager was provided with a mobile application downloaded on their company-issued iPad. Online tools to reinforce the elements of a skin assessment were also provided, as well as a laminated card with staging information for wounds. Step-by-step instructions on how to document the findings in the EHR were provided, including the procedure for uploading pictures of skin anomalies such as tears or pressure ulcers. To ensure the adequacy and quality of the data, an extended time for questions was provided, and each RN case manager confirmed understanding of the documentation process. Data was collected to evaluate the number of focused skin assessments, including patients' EHR pre- and post-intervention, and was analyzed using an upper tail z-test for the difference of two proportions to determine if there was statistically significant difference. Items analyzed include the number of completed skin assessments documented before the introduction of the mobile application to photograph wounds, and the number of skin assessments documented after the intervention. Documented skin assessments were statistically significantly more numerous after the intervention, which introduced adding photographs to the EHR. There were 15 targeted assessments among 112 weekly assessments before the teaching intervention, and 29 of 18 targeted assessments among 118 patients after the teaching intervention, resulting in a z-test statistic of 2.155 and a p-score of 0.0156. Since p is less than 0.05, we rejected the null hypothesis. The achieved power of the study is 0.7056, which is considered medium to high in strength. Medium to high in strength. The measures used during this the data indicates that before the teaching intervention, 13.45% of patients received a documented skin assessment in the 3 weeks prior to the introduction of the skincare protocol. Following the education, the number of skin assessments documented in the EHR increased to 24.6%. The measures used during this quality improvement teaching intervention include process measures which have been reviewed to ensure that the proper steps were taken and procedures followed. The new skin assessment protocol, including implementation of the addition of photographs to document any skin anomalies present, was successfully adopted by the hospice organization. The protocol improved the documentation of skin assessments in the patient's EHR, with an increase in both the number of assessments recorded as well as an improved implementation of the photographs being included in the patient's EHR. Outcome analysis pertains to whether or not the initial goals of an intervention are met. And we statistically showed that we had significant improvements in the documentation of the skin assessments. The initial percentage of targeted assessments was increased after the teaching intervention. The rate of compliance increased from 13% to 24.6%. The photos assist a physician as well as the wound care nurse to make appropriate treatment recommendations. There were limitations, including the company where the hospice organization was sold in January 2022, which meant that there was a new corporate structure. They also added several new projects during the time of the skincare implementation, and there was a relatively small sample size with only 42 patients. In the future, we believe that we could investigate the use of photography for wound care, also for pre and post surgical interventions, that photography could be used successfully for that. Photography could also be used to show disease progression. Perhaps it will become a standard treatment according to the US FDA, which right now has culture and cleaning and dressing wounds as the standard of care. In the future, perhaps photography might become a standard treatment. In conclusion, according to the NHPCO, 55% of hospice care occurs at home, which means that patients are not routinely observed by physicians or specialists, as care is provided directly by nurses. Using pictures to enhance documentation means that higher level providers can easily observe wounds and make recommendations for treatment. Patient safety is increased when proper treatment is readily available, as is the quality of life for hospice patients, including reduced pain and odor and discomfort for existing wounds. This quality improvement project successfully demonstrated that providing RN case managers caring for hospice patients with a mobile application to photograph skin injuries improves the instances of targeted skin assessments. To my colleagues, fellow classmates, and Maryville professors, your support is greatly appreciated in participating in this presentation. And a special thanks goes to Dr. Jennifer Brunworth, who was my project chair. Thank you so much.